Hello, and welcome to this Tri-Service Workflow, TSWF, training session for the low back pain CPG AIM form. My name is Don Rumbaugh. I'm a family physician, ex-family doc, and flight surgeon for the Air Force, and member of the TSWF team. We're clinicians. We work with the DHA to design and deploy the TSWF forms aimed at standardizing and simplifying MHS documentation and workflows across the three services. Today I'll be training you on the low back pain CPG AIM form, walking slide by slide through its accompanying PowerPoint training slide deck. So you can be asked by your providers or staff, why should we use low back pain form and not just the core? Well, the low back pain CPG AIM form, as any TSWF CPG AIM form, condenses the extensive CPGs into concise, easily accessible tools at the desktop, the point of service. Now, the form contains a synthesis of the key elements of the CPGs, provides great references for decision making, it improves continuity of care and thus healthcare outcomes. And you'll see that the low back pain form provides great links to patient education materials and standardizes documentation across the MHS. So let's look at the workflow using the low back pain CPG AIM form. The support staff will determine if the patient's chief complaint is low back pain. They then can load the low back pain form as appropriate, but if they have a question regarding whether to load the low back pain or not, they can default to just loading the core form. Either way, when they finish the screening, the provider can then load the low back pain CPG AIM form and take over ownership of the support staff's note. The provider then reviews the information completed by the support staff and completes the note. So why is low back pain diagnosis and treatment so important? Well, low back pain is the number 5 reason for outpatient visits in the United States and is the most common reason for medical disabilities. So low back pain markedly impacts mission readiness. So the AIM form can support your evaluation, management, and documentation of low back pain. Before we get into demonstration of the form itself, I want to let you know about the ECHO project. Project ECHO gives you the opportunity to benefit from resources when you're at a remote location through live webinars, didactic sessions, case presentations, and virtual grand rounds. Topics are generally, at this point, chronic pain, diabetes, and traumatic brain injury. Project ECHO provides e-consultation services which will promote better CPG outcomes and improve quality of healthcare for patients. It allows for specialty care capacity locally, no matter where you are. Since there's often a connection between low back pain and chronic pain, I want to let you know this assistance is available through the webinar, which is the first Thursday of the month. Here's the contact information for the ECHO program. Ms. Alexander comes in the clinic with low back pain. The tech can start documenting either on the core form or on the low back pain CPG AIM form. Doesn't matter. Everything that he or she documents will move from one form to the other. Now notice the area in blue near the top of the form. All TSWF AIM forms have this section which identifies the form you're using and the version. If you don't have the current version, it could be because you have the AIM form saved in your favorites with your name after it or the name of your clinic rather than Department of Defense. If you have the DoD version saved in your favorites appropriately, you'll automatically get the updates, which are every quarter. To the right of the form version information, you'll see some quick links. One of these is the link to the Mill Suite. This is where you can give us information on the form. You ask questions, give criticisms, make suggestions. We monitor the site, and questions and suggestions go to our leadership meetings on Friday mornings. When we do the quarterly updates, they're on the basis of the suggestions that you've given to us. You'll get a response when you post questions on Mill Suite. So this is the best way to communicate with the team about the form. Prior to the visit, days before, the tech can open the encounter using open not checked in. With the encounter open, the tech can copy forward information from a previous good encounter. Tech will then enter the chief complaint, fill in the HPI, the pain level, and the pain assessments area. Note that the link to the DoD VA pain scale is right there before you. Some clinics print out the scale, put it on a sheet protector, and have the patient point to the number, which is associated with a facial expression description that best describes the pain. As you go through the form, you notice there's some text in blue. These are clinical helps, either using the form or helping take care of the patient's symptoms. They're informational tips, hints, as you go through your documentation. Since the low back pain form is a standalone form, it can be used to document the entire visit. It has the same components as the core form. There's no need to toggle between core and low back pain. And as with all of our forms, we have the name of the form and the version and the link to Mill Suite. The low back pain form has the attending physician, the chief complaint, HPI, pain level, just like the core. But you notice the low back pain HPI also has red flags and two questions that need to be asked in order to be compliant with the CPG. The two questions are, does low back pain limit activities, and have there been prior episodes of low back pain? You saw how we need to use the X to document all negative red flags. This is one of the very few times you need to click the red X. Otherwise, I try to avoid it. As you go through the form, you may be tempted to click the X in each box, and you can, but there's really no need to do so. When you type in the field and then move to another field, you'll see that the X automatically appears. If you type in the field and then go back after typing and click the X, what happens? Whoops, you lose everything you type. But no worries, there's a valuable undo button up in the toolbar of the AIM form. You just click that box and your text will reappear. The only other time you click the X is when you want to reset pre-positioned text in a field, like for annual questions. The red flags are all defaulted to negative, and clicking the red X next to red flags document all as negative. If there's one or more red flag positive, simply change the negative to a positive and it'll make it emit as positive. The two questions to the right of the red flags must be asked and documented yes or no in order to be in compliance with the DoD CPG. If you click in the little box to the right of the question, you have space to free text up to 2,000 characters. Also in the HPI tab, we have the low back pain comprehensive care plan, or CCP. Notice that it's in yellow, so that means it, right, copies forward. The CCP is not something that you have to complete in one visit. If you complete portions of it each visit and copy forward, each time your CCP will gradually fill in and include relevant and important documentation. We go to the next tab, moving from left to right, we get to the Review of Systems Physical Exam tab. At this point, the support staff has completed their portion and the provider's taken over the note. The provider's loaded the AIM form and has reviewed the HPI and screenings and made edits that were necessary. This section of the note was developed with the DoD CPG recommendations in mind. You'll notice that the Review of Systems and Physical Exam are targeted specifically to low back pain. In the low back pain specific physical exam, notice that there are auto neg buttons available to make documentation a little faster. And there's space for physical exam free text as well. There are ribbons for the physical exam for the rest of the spine. By clicking on the appropriate ribbon, you'll have the availability to document your PE in the thoracolumbar, lumbosacral, pelvis, and also for somatic dysfunction. And notice each of these areas has its own auto neg button. Well, it almost never fails in family practice. You have a patient come in for one problem, such as low back pain, they're going to come up with another problem. So there's an area for additional physical exam, additional review system tabs, so you can go ahead and document additional complaints without having to go back to the core. It stands alone. This is the rest of the additional PE tab. On the PE tabs, you'll see some of the items in gold letters separated from the rest of the items in that section by a black bar. These items are not selected by the normal button. The Exit CCP tab is a provider section. At the top of the section, you'll see the medication reconciliation. The medication reconciliation is documented by the provider on the way out, as opposed to medication compliance by the support staff on the HPI tab on the way in. Now, chronic condition self-care management section is for taking care of a patient with chronic disease. This section will copy forward. There's a ribbon for other counseling and ribbons for comprehensive care plans specific for other high-risk and chronic conditions. Okay, this tab will look at the initial evaluation and management of low back pain. When a patient presents to your clinic low back pain for the first time, you can refer to this tab for treatment guidelines. There are three categories of low back pain. On the left, nonspecific. In the middle, radicular or stenotic symptoms, and the right, red flags. If the patient's pain is nonspecific, no imaging or labs are recommended. Advice on self-care, non-steroidal Tylenol, the first line of medication with a reassessment in 4 weeks. For a patient with red flags, go down that tree for recommended treatment. A patient with radicular symptoms which are non-severe would be treated as a non-specific. A patient with stenotic symptoms which are severe would be treated more like red flag with earlier imaging. The CPG recommendations are listed on this ribbon. The CPG recommendations are listed on the charts, including interventions and diagnostic workups. After you have seen the patient for the initial visit, now you're ready for seeing them follow-up. You can assess how the patient responded for treatment and go down the algorithm accordingly. Off to the right, again, of the tree is a chart of the interventions from comprehensive care, the CPGs. And you can see in blue, the algorithm, a list of where those recommendations fit in the wiring diagram for treating low back pain. This slide shows the link, the site for the TSWF website, where you can find our training materials and resources. As you use the TSWF forms and have any comments or feedback, you can contact our team on the MillSuite site. Here, there's a link for MillSuite on every one of our forms up on the top right of the HPI tab, or you can contact your local CST as we train those CSTs to train you.